Hello to all our dedicated health professionals out there. Ever felt like there's just not enough time to provide the patient-centric care you aspire to? With resources constraints, it seems almost like a trade-off, doesn't it? I'm Ian. Leveraging my multicultural expertise and specialized training in communication science, I have collaborated with premier healthcare organizations to bridge gaps in health equity. Today, let's solve a significant problem together. How can we balance financial constraints with equitable care? I see that my healthcare executive friends are committed to their social mission of equitable care, especially when it comes to addressing the social determinants of health. But how can we do this without breaking the bank? When it comes to influencing health behaviors, I often hear about social infrastructure, motivational interviewing, and the patient activation measure as solutions. But let's dig a little deeper. On the one hand, motivational interviewing is excellent for diving into a patient's hesitancy to change. However, the limitation here is that it can be time-consuming and it doesn't always tackle the underlying issues. The patient activation measure offers insight into a patient's level of engagement with their own healthcare. The downside? It serves more as a diagnostic tool and offers little guidance on shaping behaviors. Now, here's where it gets interesting. Meet the Big Four framework, which focuses on attitudinal beliefs, injunctive norms, descriptive norms, and controllability beliefs. This approach offers something distinctively rigorous and methodical. Think of the Big Four as the acid test for improving behavioral intention. The reason it stands out? We have meta-research that suggests specific ways to effectively influence these four psychosocial constructs. Motivational interviewing, or MI, is like having a heart-to-heart conversation with a patient. It is useful, but limited. The Patient Activation Measure, or PAM, provides a snapshot of a patient's engagement, but not a roadmap for change. The Big Four framework? Consider it your GPS for guiding behavioral change step by step. To give you an example, let's hear from a patient-provider conversation.
Hello, Mrs. Johnson. It's flu season again, and I would recommend getting your annual flu vaccine. How do you feel about that?
Well, doctor, I've heard that getting the flu vaccine can really help you stay healthy during the flu season. But I've also heard some people say vaccines could have serious side effects. I'm a little torn.
I see where you're coming from. It's natural to have concerns. What does your family think about you getting vaccinated?
Actually, my family is all for it, especially because they want to protect my newborn granddaughter from getting sick.
That's a good point. What about your friends or people in your community? Do many of them get vaccinated?
To be honest, not many people I know get the flu vaccine.
I understand. And what challenges would there be if you want to get the flu vaccine?
Well, I got the flu vaccine last year without any issues. But when it comes to the shingles vaccine, that's a different story. It's quite expensive, and I can't afford it.
Thank you for sharing that, Mrs. Johnson. Your thoughts and feelings are essential for us to consider, especially as we aim to provide patient-centric care. Let's make a personalized vaccination plan for you.
In this case, the health professional methodically asks about psychosocial constructs in the Big Four framework to meet Mrs. Johnson where she is. To sum up, the Big Four framework doesn't intend to replace motivational interviewing or PAM. Instead, it supercharges them. With the backing of meta-research, are you ready to elevate your healthcare game? Take the next step. Engage with our training modules or reach out to discuss how we can tailor the Big Four to your needs.